probably won't get picked up, and I don't think this is gonna work, but we can try it like that.
Okay, thank you. Is there anybody?
Bob, why
on
don't
that?
you talk and let's see if she can pick you up.
Well, I'm still here. Is everybody hearing me okay
I can't talk.
or not?
Yes.
Okay,
We
we'll
think
do
you're
that.
fine. And if not, that's okay.
Okay,
Gosh.
so we call this
Yeah,
meeting.
I was thinking like next week. I don't know. Some reason I had it in my head.
Oh, it's okay. This month is going by really fast and it's only early yet. So,
I think what it is, working with Larry Horton, it threw me off the whole week. So
oh, okay.
Hey, we're just getting
I'll take
started.
it
Be
for that.
ready.
Okay, so I think this will be a short one tonight. So call this meeting to order and we'll do a roll call.
Here,
Larry Horton here.
We're introducing ourselves, guys. This is Lisa Gorley, City Council.
Jim
Jim,
Gorley.
thank you.
Does
Larry,
Bob want to talk first?
Bob, would you like to introduce yourself?
Bob Dalton, who's not there, but thought I am. So
Okay. The other people in the room are also Julie,
Julie Fisher.
Kelsey.
There it is.
And our media is here.
Yeah, I'm right there.
Okay.
Westcott, New Era.
Okay. Thank you. All right. And with that, has everybody had time to review the minutes?
No.
Oh, hello.
So we have Bob Dalton's on the phone here. And so
Sam, would you like to introduce yourself so we have you on the record?
Yes.
Hi, my name is Samuel Stein, physician, owner of Ridgeway Health here in Sweden.
Thank you, Sam, for joining us. Our numbers are light.
Julie.
We have a couple of people who need to leave to go to another meeting soon, so we'll be quick as well. I'm sure nobody will complain about that. Right now, we're reviewing the minutes from the last meeting.
motion to approve the minutes.
Second.
Okay, we have a motion and a second. Any discussion? No discussion. All in favor, say aye.
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 Any opposed, say nay. Motion passes. Thank you. All right. Okay, so that brings us to the reports. Really quickly, we're going to move up Dr. Horton's. I should have done that for the consent agenda, but we'll have Dr. Horton go first because of time concerns.
Yeah, I have another meeting at 6:30 at the police station. So, and some other people will be joining me out of this group as well. So, won't hurt at all to get this done early. Western University report first. We have student doctors that are actually meeting with the first focus group on December the 15th. That will happen at the school board room at 1920 Long Street at 6 o'clock on December the 15th. And they have their questions ready to go, and we then have three other meetings scheduled, but so far only 2 are filling up. So we may end up with only 3 total focus groups. And those other 2 are in January, the other 3, pardon me. So that's the report on that.
Any questions?
You want me to continue on with the Homeless Action Committee?
Real quick, do we have any questions on?
Just that I was really excited seeing the kids at the last work party.
The
Students.
college students.
Yes.
Yeah, there's actually some college students that have been helping with that project as well.
Okay. Any other questions? Yeah. I don't know why, but okay, wait, and it's, okay, there we go.
So, Sam and I, sorry, Dr. Minstein and I have been talking a little bit too loud. What? It is on.
It's on.
It's
It's
on.
green.
Yeah,
Yeah.
it's on.
The light's green anyway.
We are talking about working with OHA
Mhm.
on looking at some additional community needs assessment, and we think that there's and potentially getting some additional funding for those needs in our community. We were wondering if it would be possible to partner with Western University as part of this, or if it's sort of going over these needs as well, or if it would make sense to just bring it back to this committee. We kind of wanted to flesh that out a little bit.
My only concern would be, it took over 6 months to get the university to approve what the kids were doing already. And I'm just afraid we've got a meeting scheduled on the 15th and then the first 2 weeks of January.
Mhm.
I don't know that we could get any kind of approval through the university in that short amount of time.
Okay, pivoting a little bit. We want to meet with OHA and kind of talk through some of the community needs that we were seeing, and we could share them in this committee and then possibly have them come to this committee and have that be a larger conversation.
So one of the things that this group is going to ask is,
Mhm.
what do you think are the needs of the community? So those are, if the folks are in those focus groups, bring those out. Those are going to come before that group to talk about.
Yes.
Yes,
It,
go ahead.
we're looking also, I think, at that capacity because we're looking
Mhm.
at medical students
Right.
and what they've had a huge impact so far. And so it might actually be bigger than what their capacity is.
Larry? You're gonna-
I was going to what?
You were going to say something a minute ago. I
No,
didn't want to
I
jump
wasn't.
in on you.
No.
But I guess what I was wondering is, if that comes up and they start and they go through some of that, can you use some of their data that they get? If that's made available to OHA?
Yes, you're good.
Maybe.
Okay.
It depends. So do I need to go like this or?
No, you're fine.
It depends. So the OHA has a uniform, structured, and standardized tool set for measuring community needs. And they acknowledge, having spoken with them many times, they acknowledge that it's not a one size fits all. And they were elated and impressed to hear that we have initiatives, not even on the docket, but that are, in place and active.
Mhm.
From their standpoint, it's very unique and special, and they want to support it. Last year, the state of Oregon had $260 million worth of OHA funding it was earmarked for the Office of Equity and Inclusion, which sounds like its name, but part of its foundational pillars is actually equity and inclusion and rural communities. Given that, our service area, our greater service area, not including the town proper, is qualifies, at least from a medical standpoint, for both the rural health clinic requirements, and also as a medically underserved environment, which is lumped in with migrant farm workers. They don't know how to spend taxpayer money, and they're sitting on it. And part of their initiative to determine how to allocate those resources for initiatives that, the medical students and the community surveys needs to determine what kind of initiatives to shunt those funds to. And Kelsey and I were thinking that it was a perfect nexus of a grassroots community. I'm going to say uprising. That's the wrong word.
Initiative.
Thank you. And the intent of the OHA And I say that knowing and being sensitive to the limitations of the OHA bound by legislation. And I didn't know if anybody else knew this, but our clinic and Sweet Home was actually we had the highest response rate for one of their surveys, which I didn't think was going to go over very well, but I was pleasantly surprised. And we got accolades from the OHA.
Good.
And now it's mandatory and more paperwork. But they're very interested in teaming up. They've never had any community reach out or be so proactive.
Mhm.
And they want to capitalize on that. They're really, really motivated.
So is there's a paper survey or do
Um,
they do focus group? How do they gain their information? How do they collect it?
I hate paper.
So how do they collect their
Paper? No, they paper, they have electronic means of doing so. And then there's also an online portal that I can pay administrative staff to do data entry themselves. But there's other opportunities as well. You know, they've kind of just gotten out from under the water, so to speak, in implementing this, their one survey tool that was legislated a couple of years ago. That's going live, and Sweet Home is going to, or Ridgeway is going to be one of the first adopters of that tool electronically, because I hate paper. Which is super exciting, really, really exciting. But they love the involvement.
Good.
And I think it would behoove the community, city council, and this
this committee be appropriate?
To capitalize is the wrong word, but
Well, it's not
team up.
anything you want
It's
to
a team.
pass up.
no, it's it's a team,
There's some possible opportunities there.
right? And if taxpayer money is going to be spent, it should be spent appropriately.
Yeah.
And Sweet Home is one of those places.
If we can ask
then
for
it
it.
should be spent here. And it's not just delegated, or it's not just specifically for healthcare.
Right.
It gives community health well-being.
Well, these focus groups, so far I have 10 in the first one, 8 in the second one, and 8 in the third one. That's very small sampling. And so maybe it's possible to,
Better than anywhere else in Oregon.
well,
No, really. I mean, credit where credit is due, and please take it.
but if
Better
we're
than
going, if we're looking at some kind of paper or computer type of process, we would end up with a lot more input, would be my guess.
And
You can go ahead, but we've kind of been discussing other ways that we could get this out to the community at large, possibly partnering with some of the parents of kids in school districts, with some of the transportation, with a lot of different agencies. So we're definitely looking at that, but I think this committee would be the perfect place to kind of house this initiative and collaboration as well. So we should probably add that to new business, but
Okay.
if it doesn't necessarily make sense for the focus group, Dr. Milstein and I have also kind of put together a little bit of a list of some of the things that we were seeing as potential needs that we'd like to talk to OHA about. And then if we can get the surveys out to multiple groups, particularly groups that maybe are part of our underserved population, so that we can really focus on those particular needs in the community as well, and helping to bring those resources back into Sweet Home.
So what is the current student homeless,
11%.
which is outrageous? And because of the dynamics of our history in this community, we have a heavy burden of poverty, wages, inability to, for that population to maintain their homes, to stay housed. We're also aware that BOLI recognizes there's different types of traditional shop classes that our community hasn't even dreamed of, that would help many of our children be able to raise themselves out of poverty. there is just so many ways to look at this and to be able to help. A huge detriment was when Bimart closed their pharmacy, and that fiasco that happened is ridiculous and hurt our community greatly. So I do believe this should come to this committee because
So-
there's a lot going on here that individuals are suffering from and dealing with, but they don't have any answers to fix it. And our engagement with Western University has been amazing. It has been wonderful, and our entire community has benefited from that. But I think we have two different things and opportunities going on here.
So I think that, we can do something with the school. I'm not sure exactly which direction to go, because if you go to a lot of the parents that are in the school, you're going to get some interesting discussion on things that probably fall outside of this. Where if we target it and hit maybe some of the principals have to deal with a lot of these issues, and they probably see it as much as anybody, don't you think, Larry?
Probably. Those
Every
are the
day.
counselors.
They really, really get to see that because they get to deal with the kids one-on-one at that level. So we need to have some, those type of folks in the room that deal with that every day. Maybe the counselors, maybe the that, and they almost know better than some of the parents do on what's going on, because they get talked to sometimes before that
But-
level. But I just throwing the,
To end a lot of the cycles and the things that are going on, that's where you go. But we also have the Senior Citizen Center,
Mhm.
and we have a huge population that are struggling right now. Depression is huge.
well,
Um,
let me finish
yes,
here, because
sorry.
you have that group, you have Rotary, which deals with those a lot of the different folks. You have the different, the different groups, and maybe if we identified those groups that deal with those issues in the community, because Sean Morgan should be there. Some of those folks like that deal with this every day. Does that sound like what you're looking at for a group?
Well, I think all of that would be really great. I think we also want to look at what groups we can actually send these surveys out to so that we can get as much data as possible. So as we're looking through this, people who would be willing to fill these out and where we can get more data from a lot of the demographics that do need additional
Well,
services.
you have the
Oh.
Hope Center. You have, yeah.
So in the past, we've sent things out in the water bill. Could we send out a link to the survey so they could do it online with their phone or something?
We absolutely could, but
Does it cross the line with it being?
go ahead.
So it is governed by HIPAA and state protected health information. What our clinic has signed up for as a pilot is an electronic link to a survey for patients to fill out. So we don't have to, because it's patient reported data and we just transcribe it. So that would potentially be an option, but that would have to be cleared by the OHA.
So you're wanting
Data.
because we know that we have individuals all through town that meet different dynamics, and they're the parent, but they're also single parent or within poverty, and there's all this stuff going on. So my thought with the water bill is it would just go out to everybody.
Well, the
And then-
problem you have with the water
So
bill is you're talking 2,000 that go out.
Yes.
That's a little much for a survey, isn't it? I'm thinking you probably wanted to stay around 400 to 500.
So do you have a program that doesn't, you're saying you put it in manually, but there's survey programs that do it automatically for you.
But what he's saying is HIPAA, you can't do that.
Well, you're not asking names. It's people's willingness, whether or not they want to put the information in. And if they're not, they don't have any names attached to it.
Right. So the part of the goal with this survey tool is to track it against time. The data is not voided of patient identifiers, but when it gets turned into a metric that's tracked over time, it's anonymized.
Okay,
And so the goal is to get data. You know, surveys only, yes, they go far in showing initiative, desire, and need. But as far as the OHA is concerned, they need cold hard data and numbers to crunch and compare, and which is, you know, a legitimate and entirely reasonable. When they're comparing apples to oranges, you need to identify common data points between different communities. And that's statistically, from a population health, public health standpoint, that's a very common and legitimate way of doing so. I guess if we're able to show without any shadow of a doubt, disproportionately, or, you know, I think they would jump at the opportunity if there was, you know, the crown jewel, what's the other I'm looking for? Used the last time. Somebody pave the way and show other small communities who may not necessarily be, I mean, without sounding egotistical, as organized or structured in their approach to addressing these community health problems, and partner with the OHA in that regard. I think the dividends would be phenomenal.
So I have a question.
So to speak.
Oh, sorry, go ahead.
All right. From my mind, and I only have 30 minutes before I have to leave, I'm not for sure how we could combine the two. I have real concerns, only because, like I said in the beginning, it took 6 months for the university to go ahead and approve what they are doing. I'd hate to see us take another 6 months to see if we're going to add you to the mix. But I don't see anything wrong with having two types of surveys. One would be a focus group based from Western University, which then you add another one with the survey from OHUSA. So I would think they would even like that more, because you have two avenues that you're collecting data. And to me, that would even make it more important of the results.
Yeah, so this wouldn't replace in any way what Western University is doing.
Exactly.
Not, I mean, that's
Yeah,
important for the community to be involved. This would be, it's not even piggyback. It's a parallel initiative.
Yeah.
And they both capitalize on each other.
So I don't see anything wrong with doing both myself.
And I absolutely agree that you actually took the locations and avenues for collecting the data out of our common email that we've been working on. But Rotary Club, you know, the free food place next to over by the laundromat. Yep. I'm required by law to report. Samaritan's also required to report. The school district would be one. And then thinking of other ways that we could get additional data.
Hope Center.
In a targeted way.
Mhm.
We're only open 2 days a week, and our volume is.
Yeah, no.
But yes.
So to me, as you're getting ready, Kelsey, to me, I think that it's a matter of finding out what OHA expects or wants. Bring it to this committee and talk to us about how that process is going to run. And let's see if it's something that we can make happen.
So I had seen a survey on Facebook about services. I'm assuming from Ridgeway that that's different from this completely. And this one actually hasn't been launched yet. Has it?
The OHA survey?
Yes.
It's been launched.
It's
since
been launched.
2021. No, it's been Oregon State law since 2021.
So this particular survey is just ongoing? Is that what
In
we're talking about?
perpetuity, unless the voters talk with their, then yes, it's Oregon state law
What
Okay.
would be unusual
for healthcare providers.
would be if Sweet Home took it on ourselves to provide additional data outside of just the healthcare facilities, and then presented that data as a way to kind of spearhead and pilot a community moving forward with exactly this program. And looking at the community needs that Sweet Home has, we're a very unique community in that we have like a committee like this, which is very unusual for a community of our size. And we also have other type of organizations and healthcare providers who are very engaged in the community. So all of this is unusual. And then we also have a higher level of need than most communities that have this type of community interest. So because of that, we're kind of uniquely positioned to be able to start moving forward on creating some initiatives that would support our kids and adults in these areas if we can show them that we do have this higher level of need, but they need the hard data to see that. And then we could come back with a list of the type of programs we would want to implement that hopefully they'd be willing to fund.
Okay, so that's what I missed. I thought it was like a survey, not data tracking to be able to compare changes over time. And so
So do
That's
you
much
need a
more accurate.
motion or do we need to do a motion from the committee that will accept this as one of our
goals, I don't
One
think
of
so
our
at this
projects?
Well,
point.
I'm just wondering if we need to
We kind
have
of want-
somebody from OHA come and actually
That's,
talk about the program.
I'm
That'd be
glad,
great.
Kelsey and I are very glad that you asked.
Yes.
that was our
Is that
next,
next
That
month?
would make sense to me.
We were thinking that, it was actually, Kelsey's idea. We were thinking that, it would be not even for them to get involved, but just to observe and see sort of the grassroots initiative that exists here. It actually might be nice for them to either attend virtually or in person, the community health, survey groups. Just to see the motivation and, how, we're not relying on anybody else for taking
Right.
charge of everything.
Yeah, we're moving forward.
Oh my
And
goodness, yes.
I also, Kelsey, I think I forgot to tell you. I talked to the director of the Office of Equity and Inclusion. And I talked to him about his interest of not just Real D, but an expanded questionnaire set on Real D, just as a pilot proof of concept type thing. And he was thumbs up. There's a lot of opportunity and you can make lemons into lemonade. This is a pain in the derriere from an administrative implementation standpoint. But if you're proactive, you can turn it into something not just useful that bears fruit in the long or short term, but if you're part of the process, then you're not just a passive recipient of whatever additional burden gets handed down from on high.
so I would make a motion that we move forward with this and invite OHA to participate with us and so that they can observe what we're doing.
Thank you.
I'll second that.
Okay, we have a motion on the floor and a second. Any discussion? Bob, you've been awfully quiet for somebody that's on the phone.
Well, I've just been listening to all of the dialogue and I can't help but think that Dick and I have been involved so much with all these different agencies and there's been tons of information gathered. Some, with stats and needs. I would really like to see OHA, is that correct?
Yes.
Give a presentation to the group so we can better wrap our heads around it. As far as identifying resources, that's one of the things that Dick and I was working on to sit down with the school superintendent and have that sort of dialogue. So one thing that concerns us is we have too many people running off and doing different things. And so an organized approach, I think, is a good way to approach this. As far as resources for our community, there's a ton of resources to our community, and I've talked to a lot of those resources from mental health on down, and so is Dick. And there is a tremendous amount of funding out there already for some of these resources, especially the one that's so dear to Dick and I is mental health. And we're hearing that so loudly from the school district, mental health, mental health, mental health. And so I guess the approach of having someone come here, that would be a good first step so we can educate ourselves on really what it is we're trying to achieve. And so I think that's a good way to start. Like I said, when I heard talking about the school district, and I thought, well, Dick and I are already headed that direction. How many more people do we want to having conversations with the school district? Because we've talked to the administrators, we've talked to the school nursing staff, we've talked to counselors. I agree, we can get them all in the same room. I'm hearing all the same stories from those different entities, of what their needs is. So to have another survey is a good thing, but it's, to me, is having a survey that's gonna not just be another survey to add to the pile of surveys that's already been taken.
So
I guess that would be my concern.
I think, Bob,
There's a lot of time and energy in that. As Larry was talking about, having Western University, it takes months and months to do this. So
I think this is just the first step. Let's have them come and talk to us, and then we'll have everybody listen to the same thing, understand why there's a survey, what it's needed for, and what this pot of money can be used for.
yeah.
So I think that's the
I
issues
agree.
that
I
we
think
need to
that's
get
a
out
good
of there.
start.
All right. So there's a motion on the floor.
Yes, there is. And we've had some discussion. All in favor?
Aye.
Any opposed? Motion passes. Okay. So, Larry, do you have time to talk about homeless before you leave?
Yeah, I can talk real quick.
Okay.
We did get the modular moved over. The water and sewer and electricity, I guess, is being connected as we speak. They've been there the last 2 or 3 days working on that. We had a work party of volunteers and some of the FAC staff that were there on Tuesday. We have, I believe, 14 huts that are ready to roll right now. And this weekend on Saturday, we have another work party that's going to take place. We're hoping to have 6 more huts ready at the end of that work party, which will make 20. And I assume that the high school will continue working on the huts until they get all 30 of them finished. So hopefully we'll have 20 up and running. Hopefully the office will be up and running within a week. I think we're moving forward, and it's nice to see progress happening.
So my question on this Saturday is, this is a pretty, a lot of things going on. I think the light parade, and that's going on Saturday afternoon. So we need to make sure we remember that. And
Well, so far I have very few people that have called to volunteer on Saturday, and I know why. I mean, it is a busy, busy day, but it is the only day that the instructor had available. I said, let's do it. We'll get as many as we can get and do as much as we can do.
What's
So-
your target on numbers for people to do that?
Well, you mean, how many people do I want there
Yeah.
on Saturday?
Yes.
I would love to have 20 people that know how to use a hammer and know how to use a level and know how to use a saw and know how to construct and build. I don't need painters. I don't need people to help carry stuff. I need people with skills that know what they're doing.
Okay.
Have you thought about reaching out to the local Boy Scout troops?
I'm not even sure we have a Boy Scout troop anymore.
we do, but
No, we have not.
We have not.
But Corvallis, Albany, Lebanon, other places that have larger populations.
They also, there's also,
Scouts, I think.
yeah, scouts, but there's also, FFA and some of those things that are around. But no, that's something that
Yeah, this group this weekend, this is
just jumped in.
the last time we had a work session, we had over 100 people there. And that was wonderful in one way, and it was a nightmare in the other way, because we could not keep everybody
Busy.
on target and doing what they needed to get done. And you can only paint so many 2x4s.
Sounds like a military problem.
It was, I thought I had 35 people signed up and 100 showed up. So
That's another idea.
that's
Maybe
why
I'll call
this time I've asked for skilled laborers, people that know how to use those tools, that are really good, that we need to get 6 huts done. And if I have, 20 people, then I can put 4 or 5 on a hut, and 4 or 5 people can put a hut together in probably 2 to 3 hours.
Maybe you can offer the general,
So-
maybe you can offer general contractors a tax cut. Tax break.
Probably so, but Saturday is here. It's only a day away. And we sent out a request asking the community for help. That's what we did last time, and it far exceeded what I ever thought was possible.
That's why I love this community.
So,
Really.
me too. But this time I'm hoping, well, on Tuesday, I asked for help on Tuesday. I had 8 people that knew what they were doing, and we got a lot done. There was a contractor from Lebanon that saw the request, and he was here, and he put on half of the siding on the exterior of the modular. And he did that in 4 hours.
What?
So
Did you want to see the form?
No, I'm okay.
So that's where we are. I know that the committee is meeting in 20 more minutes. The advisory committee, at our last meeting, which was a week ago, Brock was basically agreed that by December 15th, he'd be ready to open. December 21st at the latest, he said. So
No, it's a hard date of December 15th. It just might not be a full open.
going to be hard to open if there's no power and there's no electricity, or there's a lot of things that have to be done. We hope that December 15th, but he did say the 21st was also.
So, are they planning on an open house after that?
Well,
Once
yeah,
it
not-
starts
not-
Getting, okay.
We
in a
still,
month or so.
the showers, before we have an
Yeah.
open house, we want the shower
Everything
unit
there.
there. We want the bathrooms connected. There's a
Yeah.
whole lot of things. We can open without those things.
Yes.
But before we have an open house, I don't want people to come and see, oh gosh, where are
I
they going
know.
to take showers?
You can get porta potties
Where are they going
and
to
they
eat?
have the portable showers, but we want the permanent stuff set
Well,
up.
the more
Okay.
permanent.
More permanent.
I waited 9 months to have an open house.
Yeah.
For a good reason.
It doesn't have to happen right away. I'd even say January, February would be more than reasonable.
Okay.
But I know the community wants to see it. They want to know what it is. But I don't want to show them something that isn't complete. I think that would be a mistake. So
Okay.
I would not want to invite anybody there until we're really running a quality facility.
Okay.
And Larry, if I may chime in a little bit to what you're talking about, I had an email from Shirley Berg. And one of the things community members were asking, what are the things that they can provide to the Safe Camp? And she gave me back a short punch list of things. And she said she was going to be doing a more formal list. She was talking about such things as blankets and pillows and plastic totes for dirty clothes underneath the bunks and things like that. So there's the little small stuff that'll be coming at some
Right.
point.
Good, thank you.
Yeah. All right. That's good. That's really good. Okay. Then we'll jump back up. Bob, you had talked about possibly for the community health fair outreach, the continuing outreach. You had talked about doing some community engagement. How are you doing on that?
Well, is Dick online or is he not there tonight?
Nobody's online tonight.
Okay. Well, Dick and I have been talking and he's following up with the school superintendent because that was our initial first step. One is to sit down with the school superintendent as he was going to explain to us the needs of the school. And once we had that meeting, then we'll have a better sense of direction on what are the resources we need to do as a committee to help find for them. So that's kind of ties back into what we were talking about a little bit earlier. As far as some of the other outreach ideas we had talked about, again, we know that mental health is a big one. And Dick was going to go back to some of his resources that he works on the various boards. And we were looking at either doing something once a quarter or at least a couple like community outreach where we actually invite the public to come in and participate with some guest speakers that can actually touch upon those topics to kind of educate the public. So I mean, that's kind of where we're headed right now. I mean, I had an incident just yesterday with trying to navigate with my daughter through Medicaid and Medicare. And after talking to Mr. Knowles, he said, you know, this is a common problem and probably something that the community themselves have those same questions I was having, you know, how to sort and navigate through all the resources that are out there. So that might be another possibility. But we were looking at something like the senior center that opens up to a very large area, some common areas. I know Dr. Sam had talked about even his facility has, you know, pretty good square footage to hold such an event. So we're just, it's kind of moving at a snail's pace right now because one, it's the end of the year and the holidays are upon us. And but anyway, that's what we're currently working on.
Okay, thank you. Anybody have any questions? I'm trying to move us quicker because we have Kelsey and Dr. Horton have to leave. There was any other old
You-
business?
You asked me to do something if you want to tell.
That would be new business.
Okay.
Okay, so for new business, we have discussed Ridgeway with the Oregon Health Authority and maybe coming to meet with us. We also have, because we transitioned our time and day, and we also have gone through COVID, our numbers have dwindled significantly. So because Jim doesn't have anything before him besides Christmas committee right now and Rotary, I've asked him to go ahead and do outreach again to bring people back to us and to reconnect with those people that provide health services or the engagement that we need to rebuild our group again. And so that's a project. Do we have any questions or to go with that?
Can I donate catering
Catering?
and bribe?
Oh, we would love that. People love food. Anything else? Okay.
You're talking to a Jew. We speak food.
Okay. And if there's no opposition to the idea and no further business before us, I'd like to call this meeting adjourned.
So moved.
Okay.
Thanks, everyone.
Thank you.
Thanks, everybody.
Thank you.
Thanks, Bob.
Bye-bye, Bob. Thanks
Bye.
for tuning in. Okay.
Julie.
Yeah, we're out of here.